approach. In this first column, there are cases that start
the beta cell mass. So all three of these were pretty indispensable as far as I'm concerned, even though I can't really tell you.
All right, so Dr. Clare-Salzler, if you've got a kid with antibodies, what would you do?
One approach would be to use, vitamin D and also omega-3 fatty acids, which have been shown to have effects on the immune response, as well as potential effects on tissue regeneration and, in this case, regeneration of beta cells. So these are still hypothetical, but we know we have data that shows that they suppress inflammation pretty well. They're very safe, they're inexpensive, and from our perspective, it's a very good way to start and would not be a concern with regard to complications, side effects, and adverse events.
Now, would there be target levels that you would, for each one of those, that you would target for somebody? What would you recommend?
Yeah, so the dose, that we've used in the trials that we've done have been around 2 to 3 grams, but I don't have information that would say that's the right dose. So we use doses in the clinic for treating patients with lipid disorders, up to 9 grams a day, and they tolerate that very well. So
9 grams of
DHA, fish oil, whatever.
Gotcha.
And so we could see a dose range between, say, 3, 4, 5, 6 grams a day of omega-3 fatty acids. So that would be, and then the good thing to do is to be able to be associated with a laboratory that can measure those in either your red blood cell membranes, which is a very stable reservoir, if you will, for these fatty acids. They get incorporated into membranes, and it's kind of a long-term history of your intake, and it's very important that cells incorporate these things to be able to be effective in the treatment. So measuring those would be another nice way of kind of getting a drug level, if you will, and being able to monitor, if you will, the therapy.
Awesome.
Well, it would be focused on vitamin D at high doses, omega-3 at high doses, and polyphenols at high doses that are things that are lost in our normal diet. Decreasing red meat, decreasing omega-6, and increasing the good factors. So practically what happened in the past decades is that we had a so-called perfect storm, what Barry Sears called the perfect nutritional storm, because our diet has evolved to have less and less omega-3 and more omega-6, less polyphenol, which are protectives, and more refined carbs and highly processed foods that all together make a perfect nutritional storm that increase the level of inflammation that you cannot sense unless you test it with this arachidonic acid over EPA test. But you don't feel, you don't have pain, you don't have fever, and it sets you up for all kinds of negative effects from autoimmune disease, allergies, chronic degenerative disease condition. And now the rest of the world is catching up with major trials from the VITAL study from NIH and many others there was just a recent publication showing how the ratio omega-6, omega-3 is the best predictor of mortality, so that is really a field that we're just scraping the tip of the iceberg, but I'm sure in the next 5 years you will hear much more.
Awesome, thank you. So, Sonia, if you had a child with antibodies, what would you do for that child?
The same thing I did for my own son. I went back to my best friends on the JDRF Medical Science Review Committee and experts from around the world, and we came up with a cocktail, and I listened to their advice because I'm not a doctor. What they told me to do is high-dose omega-3 fatty acids, DHA and EPA, and for those of you doing that, make sure you look at the labels. Sometimes the capsules say it's 2 for the dose. Sometimes it's the level of DHA and EPA is really not consistent. That's the most important part of the cocktail. The next is to get the vitamin D level up, and you want to have that tested to confirm that it's going up to the level you want it to be at. But they work synergistically, and that's based on a lot of epidemiologic studies and cod liver oil and reduction in risk in Norway and some other countries. And then the next is antioxidants. We have both fat-soluble and water-soluble antioxidants. So you can look at things like alpha-lipoic acid, green tea, and the most important thing, and very easy to do, is just a multivitamin, preferably a multivitamin with zinc, because viruses are a part of this disease, particularly Coxsackie. So multivitamin with zinc is a great way to go. So when parents have called me in the past, I refer them to our website, www.preventt1v.org, and we tell our stories and we ask them to participate. We ask them to join the Facebook page and be part of our team. And our team consists of people who want to work with the scientists and want to go in for those visits and get their families involved and really work together with the scientific community.
And lastly, are you concerned at all that there's a police boat behind you with its lights flashing, and that they may be here to get you for your rogue ways?
Well, I'm hoping to be inducted into the Cowboy Hall of Fame, and I'm a really good swimmer, so it's okay.
All right, thank you.